My dear students, welcome to my channel. In today's video, we are going to learn knee joint. The knee joint is the middle joint of your leg, connecting your thigh bone to your leg bones, allowing you to bend, straighten, and support your body weight while standing, walking, or running. The knee joint is a synovial hinge joint formed between the femur, tibia, and patella. It allows mainly flexion and extension, with a small degree of rotation when the knee is flexed. Articulating surfaces. The lower end of the femur presents two large rounded condyles, medial and lateral femoral condyles, which are convex. The upper end of the tibia shows two shallow tibiocondyles, or platoes, separated by an intercondylar eminence. This is the medial and lateral menisci, which act as fibrocartilaginous pads to deepen the surfaces and improve the fit between femur and tibia, forming tibiofemoral joint. Patella. The posterior surface of the patella articulates with the patella or trochlear surface of the femur bone, forms patellofemoral joint. Ligaments of knee joint. Ligaments of the knee joint. The knee joint is stabilized by several strong ligaments that connect the femur, tibia, and patella. These ligaments are classified into extracapsular and intracapsular ligaments. Extracapsular ligaments are anterior cruciate ligament, posterior cruciate ligament, and ligamentum patelline. The anterior cruciate ligament extends from the anterior intercondylar area of the tibia to the medial surface of the lateral femoral condyle. It prevents anterior displacement of the tibia on the femur. Posterior cruciate ligament extends from the posterior area of the tibioplation to the lateral surface of the medial femoral condyle. It prevents posterior displacement of the tibia on the femur. Capsular ligament is a fibrous envelope that surrounds and encloses the entire joint, providing strength and stability. Ligamentum patellate. The ligamentum patellae, also called the patellar ligament, is a strong, flat, fibrous band that connects the patella, kneecap, to the tibial tuberosity. Menisci of the knee joint. The menisci of the knee joint are two crescent-shaped fibrocartilaginous discs placed between the femoral condyles and the tibiocondyles. They act as shock absorbers, improve joint congruency, and aid in lubrication and stability. Capsular ligament is also known as articular capsule. It connects the femur, tibia, and patella, and is strengthened at several points by tendons and other ligaments. Tibia or medial collateral ligament is a broad, flat band extending from the medial epicondyle of the femur to the medial surface of the tibia. It resists abduction or valgus stress of the leg. Fibular or lateral collateral ligament is a straw, cord-like band extending from the lateral epicondyle of the femur to the head of the fibula. It prevents adduction or varus stress of the leg. Obliquopopliteal ligament is an expansion of the semimembranous tendon, running upward and laterally across the back of the knee. It strengthens the posterior capsule and prevents hyperextension. Blood circulation of the knee joint. The knee joint has a rich blood supply to ensure nourishment to the bones, ligaments, and surrounding soft tissues. The circulation is mainly provided by branches of the femoral, popliteal, and anterior tibial arteries. The main artery supplying the knee joint is the popliteal artery, which lies behind the knee. It gives rise to several genicular branches that form a vascular network around the joint known as the genicular anastomosis. Genicular anastomosis. This is a network of arteries around the knee that ensures continuous blood supply even when the knee is flexed. The veins of the knee joint form a genicular venous plexus that accompanies the genicular arteries. These veins drain blood from the joint capsule and ligaments into the popliteal vein, which continues as the femoral vein. The great and small saphenous veins also assist in draining the superficial areas around the knee. Nerve supply of knee joint. The knee joint receives its nerve supply mainly from branches of the femoral, sciatic, and obturator nerves, which give rise to several genicular branches forming the genicular nerve plexus around the joint. The femoral nerve, through the nerve to vastus medialis and saphenous nerve, supplies the anterior and medial parts of the capsule. The obturator nerve contributes a branch to the medial side. The tibial nerve gives superior medial, inferior medial, and the important middle genicular nerve, which pierces the oblique popliteal ligament to supply the cruciate ligaments and synovial membrane, and the common peroneal nerve gives superior and inferior lateral genicular branches to the anterolateral region. These nerves interconnect to form a genicular plexus that accompanies the genicular arteries, providing sensory, proprioceptive, and vasomotor innervation to the joint, ensuring effective coordination, stability, and pain sensation of the knee. The posterior surface of the knee joint is mainly supplied by branches of the sciatic nerve and its divisions, the tibial and common peroneal nerves. The tibial nerve gives off superior medial and inferior medial genicular nerves to supply the cruciate ligaments, synovial membrane, and posterior capsule. The common peroneal nerve, another branch of the sciatic, contributes superior and inferior lateral genicular branches to the posterolateral region. These branches ensure rich sensory and proprioceptive innervation. Movements of knee joint. The knee joint mainly allows flexion and extension, with a small degree of rotation when the knee is flexed. Flexion, bending the knee so the heel moves toward the buttock. It is produced by the hamstring muscles, biceps femoris, semitendinosus, semimembranosus. Please check my previous video of femur bone for muscle attachments. Extension is the straightening the knee, bringing the leg in line with the thigh. It is produced by the quadriceps femoris muscle group. Please check the previous video of femur for quadriceps muscle attachments. Medial rotation. When the knee is flexed, the leg can slightly rotate inward, performed by popliteus, semitendinosus, and semimembranosus. Please check the previous video of femur for hamstring muscle attachments. Lateral rotation. When the knee is flexed, the leg can slightly rotate outward, mainly by the biceps femoris. Clinical correlations. Unhappy triad of the knee joint, a combination of injury of the A tibial collateral ligament and medial meniscus and G anterior cruciate ligament is called unhappy triad of the knee. Osteoarthritis is a degenerative wear and tear of articular cartilages. Being a weight-bearing joint, the knee joint is commonly involved in osteoarthritis. Injuries to cruciate ligaments. The anterior cruciate ligament is more commonly damaged than the posterior ligament. The anterior cruciate ligament is injured in the anterior dislocation of the tibia, whereas the posterior ligament is injured in the posterior dislocation of the tibia. Tear of the cruciate ligaments leads to abnormal anteroposterior mobility. Thanks for watching. Don't forget to like, share, and subscribe for more informative videos. See you in the next video.